Contact! I'm hit! I'm hit! He's still there. Cover me. Where you hit, man? Man, lower extremity. Where? Higher. Lower. All right, I need your help over here. Moving.
Can you get your rifle off you,
All right,
bud?
man. We need an intuband, quick. No, I'm good. I can breathe. I can breathe. No.
Come on. There you go. There you go. He's doing better.
Oh.
He's doing better already.
Oh. You'll be all right, buddy. No. Take another bite of this. It stings.
What is in your IFAK?
IFAK? I thought you
Yes.
said I snack.
Yeah, you ain't got no medical in here?
Let's not worry about that right now. Intubate me, Daddy. Oh, yeah, there you go. Who needs ice packs when you got the ice snacks?
Ladies and gentlemen, and most importantly, all of you Elmer Fuds out there, welcome back to the channel. Guys, today we're going to be talking about IFAKs, what's in them, and how to use what's inside. This is just going to be a quick video. We're going to cover the basics, not going to get into details. A quick background on myself. I was a combat medic in the Army Reserves for about 6 years. And I was an EMT on a couple different ambulances for different counties for about 3 to 4 years. So I have a little bit of experience, but I'm certainly no expert, so take it easy on me. Today we got Bob here as a patient. Bob's been my good friend for about 2 years now. So getting into it, IFAK stands for Individual First Aid Kit. It's what I recommend everyone carry, especially if you're going to the range, if you're by yourself. So don't rely on other people. Get the training, you're already in the right place. Get the training, practice with what you got, practice on your buddies. So if you just got your IFAK and you're wondering where to put it, if you have a tack, like a battle belt or just a backpack or something, make sure it's somewhere where you can quickly get to it. If you're putting it on your battle belt, make sure you can reach it with both arms, because say one gets injured or blown off, God forbid that happen, you're able to reach it with your non-injured arm, because if it's in an inaccessible place, you might not be able to get to it and you'll kind of be screwed. This is my IFAK. I assembled it myself because there's lots of kits online, but I kind of wanted to tailor it towards what I wanted. There wasn't something that I particularly liked. Plus it was a little cheaper to get what I wanted individually. And if you don't have a lot of money, you can buy things, every week with each paycheck and just assemble it from there, because it can get expensive. Like combat gauze is like $53. Getting into my IFAK, I have some gloves. I may or may not use them, but I have them there just in case. I have some trauma shears. These are the little Raptors. They have like, what you call them, seatbelt cutters, a little oxygen thing, which I've used like twice. But they cut really well. Going in after that, I have my tourniquet, which is my training one. Make sure when you store it, it's where you can easily rip it apart. I didn't prep this one very well, but when you need it, you're gonna need it really fast. So just have that one easily accessible. And you can have them stored anywhere else on your gear. I mean, you can't have enough tourniquets. After that, I got some combat gauze. Like I said, it's a little pricey, but definitely don't hesitate to spend the money if you can. Also with the tourniquets, don't get knockoffs. It's not worth your life to get a knockoff that won't work when you need it to. So get the cat tourniquets, the soft tees, just pay the extra money. Like I said, you can buy the stuff over time and it's easier. I've got some medical tape to secure things like the MPA that I got here. you never know when you're going to need it, because it can get bloody mess and you need something to secure stuff down. Also, I got a Sharpie for the tourniquet or at the time, and also any other medical information I need. I got a emergency trauma dressing. It's something that you most likely going to put over the combat gauze after you pack it in, which I'll show you that in just a little bit. Also, I got MPA. It's open right now because it's currently my training one, but also I have a hyphen, chest seal. I have the small little twin pack, and also a little 4x4 gauze just in case it's bloody and I need this to stick. I can wipe it real fast so I can get a good surface to stick this onto. So that's about it. So the acronym we're going to be using today is MARCH. It is used by the military for combat casualties. Stands for massive hemorrhaging, airway, respirations, circulation, and hypothermia. So the first thing before you even treat your casualty is you want to make sure the scene is safe. If you're taking fire, you want to return fire. And, you know, everybody that's seen Saving Private Ryan knows the scene.
This goddamn kid! Come on! I wouldn't venture out there, fellas. This sniper's got talent.
Where Vin Diesel gets hit by that sniper and they can't go out and get him because there'll be other casualties if they do. So you have to eliminate the threat before you do. And sadly for Vin Diesel that day, family was not first. So
you don't turn your back on family.
So call 911 as soon as you can if you're at the range or something like that. You know, combat scenario, return fire, eliminate the threat. If the casualty can treat himself, have him treat himself. That's what the IFAK is. It's an individual first aid kit for you. Now, when you determine that you're seen safe or you're able to move your casualty to a spot that you can treat them, you're going to pull from his IFAK first. So whatever is going on, you want to use his IFAK because he's the injured guy. It's his medical kit. That's what we're using. You don't want to pull from your own because then you're screwing yourself. So, and hopefully, unlike the intro to this video, your buddy actually has his gear and it's not Skittles, Snickers, half-eaten Subway sandwiches, MRE bags, whatever it is, Roman male enhancement pills, you name it. So starting off, we got M for massive hemorrhaging. When you come up to your patient, you want to do a visual sweep. Is he bleeding from an extremity? And if he is, you want to grab your tourniquet and you just want to do a quick, hasty, high and tight. Oh, you can do over the clothing. Just want to come in, throw it over, put it through the loop, cinch it down real good, because if it's not, it'll start sliding around. So after you get it on there real good, you want to tighten the windlass. And I'm not going to torture this guy here. He didn't sign up for this. So tighten it, and it's going to be uncomfortable. Tighten it as tight as you can go. And then I like to wrap this around it nice and tight. So it's not flapping everywhere and it doesn't come loose. Tighter the better. The tight ones really hurt. So you use the little flap here, and then you get your Sharpie and write the time. And then hopefully, if you've done it correctly, it should stop the bleeding from here down. Why the time's so important is because you don't want to keep a tourniquet on longer than about 6 hours. So when you get to that next level of care, the doctors know when it was put on, so they know when to take it off. So. Now, if you're like on the range and you know for sure that's the only injury, and you're comfortable with it, you can just take the tourniquet and put it 2 to 3 inches above the wound and not on a joint like your elbow, because that's not going to be a very secure location. So say you got shot right there, you want to come above the elbow and put it, you can put it there if you want. But if not, you can't go wrong, high and tight, top of the extremity. Next, we got airway. You want to, is he talking? Can he talk to you? Is it open? Can he breathe? If he's unconscious, you can't go wrong with throwing in an MPA. Now, if he has facial trauma, this might be a contraindication, which means don't use it. Because if his face is practically gone, it's not going to be very, very good for him. If you're going to use the MPA, if you only have one, I mean, you got to use what you can. But if you got a couple different ones, a 28 French is what they're called, is the most generic for most adult males, which is why the military uses more often than not the 28s. But if you have a couple different ones and you want to measure from the side of the nose to the earlobe, which this one perfectly fits Bob. So you can use blood, you can use, it usually comes with lube, but if the soldier or fellow has used his lube, you can use saliva or blood. Yeah. So you want to do bevel towards the septum, lift up, and if they're able to, have them swallow while you're inserting it, and go all the way down, and then it'll stop right there. And a good way, a good use of your tape is to tape it down. That way it doesn't move, because it is going to be all lubed up. So it could fall out. So you want to tape it down and keep it secure. And what the MPA basically does is that it's gonna keep the tongue from falling back and including your airway. Now, there are many things you can do with the MPA and the lube that it comes with. However, there's some things that you just don't do, and you know, you probably don't want to use it as a pipe.
Shelly, what is this? Get you a hit of that.
I mean, who in the world would use it like that? I mean, so going to the next one is going to be R for respirations or breathing. So when we get to here after the airway, you make sure the airway's patent. You want to get to the breathing. So you want to expose his chest. If he has on plate carrier, take it off. If he has on a shirt or anything, take that off. You can use your trauma shears to cut it off. That's what they're for. But you want to get the chest exposed. You want to see, is their chest rising and falling equally? You want to see, you know, is it a good rate? Probably not going to be, but these are things that we're looking for. But say you open and expose the chest and he has a bullet wound right there. First thing you want to do is occlude it. So you cover it and you get your handy dandy chest seal. And if you have a buddy, it's best to have a buddy, you know, help you out, cover it. So if you don't, go ahead and open it up. And it does come with some gauze to wipe the blood, but I have some extra just in case it's not enough. So wipe it, and you want to have your buddy exhale while you're putting this on. See how I'm exhale, exhale, exhale. Take the little wrapping off. And as he's exhaling, you want to put the center of it over the bullet wound or stab wound, whatever the wound is. Place it on there, slap that bad boy down, and you're good to rock and roll. Very simple, but it helps to stop from air getting into his chest cavity and filling up, and it helps prevent that tension pneumothorax, which is air filling the lung cavity and pushing on the good lung, which is a bad deal. But after that, you wanna check his back and check for exit wounds. If he does have one, you're gonna repeat this process. If you don't have any more chest seals, a good thing that I learned is you can use the wrapping here. You can cut it open. And you can use this as another chest seal. Just it's not paper, so it's not going to absorb, but it's going to block the air from coming out. So you basically, I'm just going to show you. Well, I can turn it around. So you say he has another one, you don't have another chest seal. Just throw this on there and use that handy dandy medical tape. That's so handy. and tape all sides down. The 3 or 4 sides down, I've heard different things in EMS and Army. Just tape it all down. I mean, you can't go wrong. So the next letter in the algorithm is C for circulation. So circulation, we're gonna check the color, condition, temperature of the skin. Is he pale, cool, and clammy? Could be signs that he's going into hypovolemic shock, which is massive loss of blood. So, but before we get there, this is a great time to convert your tourniquet. You can break out your combat gauze, and for demonstration purposes, because it is expensive, I'm just going to use a little roll of gauze to simulate it. So you got a bullet hole here. We'll imagine this is his arm, but say this is his shoulder here. Of course, you want to, occlude it. And you want to take your combat gauze. You want to keep it nice and tight, and you want to press in with the finger and pack into that hole. It's not going to be very comfortable, but it's something that it's got to happen because it has that hemostatic agent in it to help clot that bleed, which it could have been an artery, could have been a massive vein, So just keep packing and packing until you either run out or it's packed as full as you can get it. Once you have it all packed, you want to push and hold pressure for about 3 minutes or so. Again, if you have a buddy, this is a great time to use that buddy and to hold pressure. In the meantime, once you get that held for 3 minutes, you want to get your emergency trauma bandage or Israeli wrap and bust that puppy out. And so you want to put the pad side down to cover it, and this is what this is going to do, is put pressure on it. And it's going to kind of act as a tourniquet, but not as tight. But you just want to wrap it, and then when you get it to this little plastic piece here, push it in there, and then you want to fold it back on yourself, and this is what's going to create that pressure to push down on it, on this little piece here. So you wrap it back, and you want to keep it nice and tight. The tighter the better. When we come to the end here, you take this little piece and it's going to ratchet itself in so it doesn't come loose. And there you go. My cameraman didn't want to participate in this one, so this is what I got to work with. I'm sorry. But yeah, so you can convert your tourniquet this way, or you can use it in addition to the tourniquet and stop that bleed. Now, with the color, condition, and temperature of the skin, if he's pale, cool, and clammy, starting to get a little loopy, could be signs that he's going into shock. He's lost too much blood, stuff like that. You want to, now we're moving into H, which is hypothermia. With the loss of blood, his body's going to start shunting that blood to his core. And the body's just going into decompensated shock at that point. So we want to get a warm blanket, a emergency blanket, whatever you got, and you're just going to wrap them in it and try to keep them as warm as possible, get them into a warm place, and put them in a position of comfort and keep them there until you get the medical help that you can get. 911, Casovac, Medevac, whatever you got. So in the meantime, just try to keep them as comfortable as possible. Now, an important part to note is that this stuff, it's not a definitive level of care. Yes, it can save your life, but you really need to get to the hospital, to the next higher level of care, to those medical professionals that can do the surgery, get him the medical treatment that he needs. This stuff is temporary. It's only going to prolong your death if you don't get to a hospital as soon as possible. So keep that in mind. Like, yes, it's great to have this stuff, but getting this man out of here and to the nearest hospital or medical treatment facility is imperative. So make that your highest priority while you're treating him, even before you start treating him. When I said scene safety, call 911, that you should have someone doing that as soon as possible to get people on the way to help. Guys, thanks for watching. Like, comment, subscribe. We've been taking mass casualties in the comments lately. Few people have been hurt. I won't name any names, but Kevin Hart, thank you for your service. Keep it up, man. We love you.
You guys have, we call it autism.
Got nothing else for you. Have a good night. We love you. See you on the next one.
I love USA.